Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Thanks for being a listener of the podcast. And if you are trying to figure out how to get home with the work done, this is exactly what I love to teach physicians and clinicians. And you can have a glimpse of the strategies that we use to help you get home with today's work done at our next free live webinar. Stop Taking Work Home is a webinar where I'll be teaching you the 4 proven steps of how to get home with the work done, even when you're in a clinical environment where you don't have control over the EMR, the patients that you have with the team that you have right now. To enroll for the next webinar, go to chartingcoach.ca/live and you can register for your seat right now. Hi, everybody, and welcome back. Today we have with us Dr. Debra Clary, and she's coming to us as a new perspective, not from a medical background. And I am interested to hear her perspective as it pertains to medicine and teams and leadership. So welcome.
Thank you so much. I appreciate you having me.
Yeah, tell us about you and your background.
So my background, although I'm not a physician, I did spend nearly 20 years in healthcare, but that's not how I started. I actually started right out of business school driving a route truck for Frito-Lay. So I was delivering snacks in the city of Detroit, Michigan in the US. And I spent about a decade at Frito-Lay. Then I spent a decade at Coca-Cola. So moved over to the beverages and I spent a decade there. And then I went to the hard stuff. I went to Jack Daniels. I was vice president of strategy for Jack Daniels. And then I got wildly interested in human behavior. Like, why were some leaders amazing and great and cultures were great and others were not so much? So I decided to go back and get my doctorate in really trying to understand human behavior and then org design and leader development. So how could we develop leaders that could really lead strong cultures? And so after I graduated, I moved into healthcare. And I spent the last 18 years of my career working for Humana, which is a large insurance company. And I worked in leader development, helping leaders shift transactional relationships into really caring for our members and our patients.
Okay, there we go. That's very interesting. So we hear a bit about executive coaches as they work in the industry world with engineers and things. But your executive leadership, is that where it started in healthcare as you
Well, I
came out of
was,
your doctorate, or that
well,
was
I
part of
was,
what you were doing at Jack Daniels?
yes, I actually, my first 2 decades was in leadership roles, but I was leading P&Ls. So I was driving revenue operations. And then I got wildly interested in human behavior and thought, how could we shift it?
Yes.
If we knew better, if we could do better, would we create a culture that people could really thrive in?
Yeah, okay, I love that. Tell us what you discovered then working in healthcare. Where weren't we doing well? What has helped shift things for the people working in them and our patients?
Yeah, so I'm approaching it through the lens of leadership. And so, how
Hmm.
could leaders better understand their teams, but also how do they better understand their customers and clients? Humana healthcare company. So, we had clinics and physicians, and then we also had the sales arm. So, they were selling the insurance. So, the first thing that we did is we wanted to move away from being transactional and being transformation. And that means developing better relationships with the people that sold our products, but then it was also with physicians, helping them understand the power of asking questions of their teams, but also the power of asking questions of the patients that they were seeing. And in our research, and it was in 2025, we released a book called The Curiosity Curve, which is in partnership with a research team and wanting to understand the relationship between leadership performance and curiosity. It was my hypothesis after spending almost 4 decades in navigating complex systems, what was missing? And my hypothesis was it was curiosity. And so we did some primary research. We came back and said, curiosity drives performance.
Interesting. Tell us more about that.
Yes. And so we found in our data that leaders that had created an environment where they allowed people to ask questions, they allowed people to challenge the status quo,
Mhm.
actually saw greater performance than their team members that did not do that. So if you compare leader to leader, the leader with the highest level of curiosity had the highest performance. And of course, the reverse was true. I was recently in Saudi Arabia. I was speaking to the ministers of defense. And in Saudi Arabia, the government runs the hospital systems, and everyone running the hospital is actually a general. And so I'm speaking to 3,000 generals who also are medical doctors. And I was talking about the power of curiosity. And this conference has happened to be around safety. So how do we
Mhm.
ensure safety measures are in place? And one of the things that in a conversation with a Q&A, a woman said, here's one of the things that we implemented is that it's important for physicians to come in and before they see a patient, they need to clean their hands. But sometimes they would forget because they were rushed, they were going from room to room. And so they came up with a saying that didn't embarrass anybody. The saying was, "What's up, doc?" That was the clue that, oh, okay, I have to go and quickly wash my hands on that. So the sense of being able to challenge and also remind people about the power of safety by asking a question. What's up, doc, is a question.
Oh, interesting. Okay. I like that because I can see how it undermines the position of the physician and almost interferes with their cognitive, what they're about to do in the room with that patient. If somebody interrupts right before they get started with the patient, however, it was important for safety that the physician's hands are washed. And so we're trying to do that without fully creating that emotional piece that happens that can disturb us with regards to interruptions.
Yeah, you think about that. It held integrity with the physician, wasn't embarrassed, but it also probably gave reassurance to the patient when they're seeing the physician washing their hands.
Yeah, and the team member that, okay,
Yes,
safety has been
yes, we are
upheld
in it
here.
to get, we are in it together.
Yeah. Okay. Love that. I love this curiosity idea because this is how I approach clinical day with physicians. We just look at the way they're running their day and they do it day in, day out the same because a lot of physicians are really an isolated piece of the clinical day. They're working independently, even though they're interacting with the team. And we just question everything. What time do you start and why? Why are your appointments 15 minutes long? Everything
Mhm.
gets questioned. There's curiosity always. Yeah, why are your team doing that? Do they have to do that? Could they be doing something else instead that would be of higher priority? So this curiosity piece, we just keep being curious about every aspect. So I love that you're asking the leaders to be curious. And I see a lot of physicians come to their leadership saying, why does it have to be this way? Why can't we do this? If we just did this, wouldn't that be more helpful? Is
Mhm.
that what you're seeing and teaching at that leadership level?
Yeah, so the first thing I do, and I work at the top of the house, so I'm working with the C-suite because all changes occur there. So if the C-suite isn't moving, nobody's moving in that sense. So I know the value of making sure that the executive team is in alignment. And so it's one of helping them understand the value of creating a culture where people feel that they can speak up, that their point of view matters, and
Mhm.
beginning to help them understand how do you do that? So the first thing that you would be doing is you can't just go in and behave differently and people and you start asking questions and people are like, wait, what's going on? Is there going to be a
Mhm.
layoff? What's happening? Is be able to introduce it in the sense of I'm working on being more curious, I'm working on getting is soliciting more of your feedback. So I just want you to know I'm trying out new behavior so that no one's freaking out that why are they behaving so differently in the sense. And so The that one is telegraphing, this is, I'm trying on new behavior. That's the first thing. And then begin to do it. So when somebody asks a question, you listen and you may invite other people in to say, wow, that was an interesting point of view. What did other people think about what John just said? So you're beginning to show this collaboration of that was one point of view. Who has a different point of view? Who wants to add to that in the sense of creating that space? The best thing a leader can do to create a culture of curiosity is when somebody asks you a question, you say, I don't know, because
Hmm.
you're showing vulnerability and that you're inviting a conversation. It's, I don't know, but let's talk about it together. I might have a point of view, but I want to talk about it. So you're inviting people in to have a conversation about innovation. What could be different? How can we serve the patient in a different way? How do we run the clinic in a very different way? It's about being open. Now, we start off in the world as being curious. Children ask 298 questions a day. You might say, wait, I mean, they're toddlers. They can't even talk. If they're pointing, that's in a sense asking a question. But we teach children to become incurious. We have them sit in a seat, you be quiet, you don't talk, you raise your hand. And I understand there's a lot of good reasons to do that. But we begin to teach them consciously or unconsciously is not to ask questions. You're to have the answers on a test, but you're not to ask questions. And we teach them things like don't open Pandora's box, curiosity killed the cat, all of those things. And so then what happens? We graduate, we go to university, we become a lawyer or a physician. We're experts in our field and we get paid for that expertise. And oh, by the
Hmm.
way, we have time constraints. And so
Hmm.
because of that, we begin to narrow our ability to our desire to ask questions. And what occurs is that our certainty kicks in. And when we feel certain, is when we narrow curiosity. And that's where dangerous things can happen.
Interesting. I know that inside the room, uncertainty creates such anxiety for physicians when they're working at their expert level, but they have a patient and there's some level of uncertainty about what's going on. It makes them feel very uncomfortable. And they're searching for certainty where it may not be present. So we may just not be able to get to the answer for this patient today. It needs further workup, further visits, another level of specialty, whatever that is. That level of uncertainty creates discomfort. But you're saying we should be searching for or encouraging some of that uncertainty in other fields outside of that clinical space.
You think about it, just certainly in the huge breakthroughs that have happened in medicine, it's happened because someone was curious to find a different way of treating something, right? Or they've come up with a new pharmaceutical remedy or something like that. It all starts with the question, how could we do this better? How could we solve this disease? How do we cure this type of disease? And it's interesting in the field that you work in, we're talking about life and death in a lot of
Mhm.
situations. If I go into the ER and I need immediate surgery, I want a doctor that's certain and confident, right? I don't want them necessarily asking a bunch of questions. So there is a balance there. There is that need for expertise, and I'm confident that we're going to get you through this. But there are other situations, especially in physician practices and in clinics, we have more freedom to ask questions like what you were saying in terms of how do we make these rounds better, or how can we use technology to serve the customer, the client, to the patient even
Mhm.
better. So there's a balance between that.
Oh, 100% agree. And I think this is part of what makes it hard for physicians to move into leadership is they bring that desire to find certainty and their method and they know what works and they are very good at what they do. They bring the expertise. When we move into leadership, that can be opposite of what you need as a leader. So when we move physicians to leadership, they don't like delegating. They like to keep it all to themselves because they know they can do it well, or they aren't as comfortable with that curiosity and uncertainty and letting the team have a say in this. While we try and be patient-centered in the room, that translation of skill set, you can see what is going to get in our way as we start to move into the leadership of how could we make this day run better, or how can we make this organization run better. It now requires me to put down some of that certainty and start being more curious, ask and invite all other options or team members' inputs, or being really curious about why do we do it this way? What can we
Yes.
stop doing? What can we do more of that would be helpful for either patient quality care or us all getting home on time, whatever it looks like that we're moving towards as a team.
Yes. And what I have found, similar to what you just said, is that leaders that are now physicians that are now leaders, they just what you said in terms of they don't want to delegate, but I will also find that they're more directive. So if they're giving orders of you need to do this and that, and there are certainly times when you need to command a room like that. But I wonder what's possible when we let those people on their teams be able to have a point of view.
I know that a lot of team members want to be able to express their point of view and would love leadership to come to the table with more curiosity.
Yes, yes, absolutely. A couple years ago, it was actually 4 years ago, my grandson, 5 days old, had open heart surgery. And they knew when he was born that this was going to have to occur. But it
Mhm.
took them 4 days to decide what to do. And what I loved about what they did, it was a by committee, coming together, looking at his results, what needed to get done, conferring with that, and then making a decision. Now, in a sense, that's a sign of curiosity and collaboration. We're coming together, we have a patient. What's the best approach here? They made a decision, they went in as a team, and thank goodness he's a healthy 4-year-old now.
Totally. That's a very nice outcome for that story. Yeah, I love that. Tell us about change. So we all get a little bit frightened by change. We've got technology advancements, as you were talking about. I see at the physician level, some are jumping in. This will be the missing piece that I've needed all my life. AI is helpful. Others are really hesitant. They don't like change. They're very resistant to it. I try and talk to some of my colleagues about using a Google form and they're confused and they're not sure if this is helpful or not. Tell us about what you're seeing about what do we need to think about in terms of leadership as we're seeing changes coming on the horizon.
So the
Okay.
first thing is that people need to let themselves off the hook because when they say I don't like change or they're just consciously or unconsciously resisting change, we're operating with a biological brain. And the brain chief operating system is to keep you safe, right? It's to keep us safe. And as a physician, you know this, and it's about efficiency and not expending too much energy. And so when something new comes at us, like we're going to change this department or we're restructuring or whatever it might be, we're
Hmm.
launching a new product, the brain instantly goes into efficiency and safety. We don't want you to be hurt either emotionally or physically. And so that is why we are resistant to change. So once you're going to know that, like I'm getting new information, my brain's not going to like this, but I have to remind my brain that it is okay. We are not going to be hurt physically in this situation. Now we're going to learn new information, we're going to take it in and we're going to change in an incremental way. And then my brain relaxes like, "Oh, she's not jumping off a cliff, she's just taking another step in that direction." So I tell leaders, you're off the hook. Your brain is working against you, and the brain also is working against us when it comes to curiosity because asking a question expends energy and the brain wants to conserve energy in the sense that you might have to run later and get away from something. So you guys are off the hook. It's not that. But in the sense of if you are a leader and you're having to make changes within your organization, the best way to do that is to be transparent and show this is the future, this is our vision, and this is how we're going to get here. And you are a part of this. So many people right now are upset about AI. That
Mm.
AI is going to wreak havoc in the organizations. And it is going to change organizations, but it's going to change it in a way that I think benefits people in medicine for sure. I think like 85% of all physicians now are using AI to help them diagnose things. It is going to help us, but you have to show people how they can be a part of the change, how they can be a part of the future.
Yeah, is that again those inviting people in more clear about where the direction is going. So I think a lot of times it feels directive from the top down. Here's your
Yes.
new electronic medical record, or here's your new thing you have to do. And everybody starts groaning, and we have all these steps we've got to complete to have make it happen. It's all very miserable.
Yes, yes. Yes, again, because the brain says, wait, I got to expend more energy to learn something. It isn't
Totally.
their organization, CEOs are making decisions every day to the benefit the organization or to benefit the patient. And it's one of you have that's why they get paid the big bucks. They have to make tough decisions. But it's how you actually roll it out is if you're going to see success or not. In the sense of we've made this decision, and this is the reason we made this decision. Now, what's the best way to actually implement it? And that's where you can get people helping you solve how do we actually implement this thing? And some people say that's going to take longer. It's going to take you a lot longer if people are resistant to it and not putting it in play. So say this is the decision and we need your help. What's the best way to execute this?
Yeah. And that curiosity of what might be helpful here, what do you need to make this successful? We know that helps teams feel more included and perhaps calm some of that level of angst about their role in the lack of decision, for better word. Yeah. Do we think AI is going to replace us? I don't see that we're anywhere near that. What is it that is kept? What keeps us here?
The benefit of AI, it just makes information abundant. So right now, the playing field is pretty equal in terms of information that's available. What's the differentiator is our ability of discernment, judgment, and curiosity. See, I don't
Mhm.
think AI can do it to the degree that we humans can do that. Also, in the medical practice, there's nothing like a physician sitting with you looking at you in the eyes and going over your lab results or going over a treatment plan. We as humans need, I think, that one on one, that human connection, that relationship, especially when it comes to our health.
Yeah, agree. I think that's super important, that being able to be examined, looked after, validated, heard, having treatments tailored to you, the person in front of the physician. You're right. It's not AI has a role and, and
Yes.
for better or worse, it's coming. It's coming. It's still not there. But yeah, we're not replaceable. Agree. Yeah.
Yes. So recently I started this longevity journey. And so I'm working with a functional medicine team. I went in and they drew 60 vials of blood. I did a brain scan. I did it, everything that you can imagine. I did that. And the results were uploaded into my chart. I took those results and I put them in Claude. And I said, tell me what they're saying. And what question should I ask my physician when I go to see him? And I go tomorrow. So tomorrow's my appointment with him. So I have information. Certainly the physician is the expert, but I'm going in with a deeper understanding of what I'm not scared of what he's going to say, because I already have looked at the results. And my good friend Claude has reassured me that there's nothing significant going on here. But I'm really excited to learn what he has to say about my results and then my next path for longevity.
Yeah. Where do people find you if they're looking to learn more about what you do and how you help leadership teams?
Yeah, so you can go to my website, which is Debra, Debra Clary, Clary.com. And on there, you'll see videos and articles. And it's also an opportunity to learn more about my book, The Curiosity Curve. And if you'd like to purchase it, it's on Amazon.com, The Curiosity Curve.
Perfect. What have we not talked about that we should be talking about?
I'm wondering about how physicians are feeling about their patients coming in already armed with data. So, like, I'm going in tomorrow with all of my lab results and all of my scans, but I'm still curious to hear what the doctor has to say about that. I'm wondering how physicians feel about people showing up with data.
Oh, I love that question. I'm going to pass it back with just a funny antidote from learning group yesterday. So I have learners in my team, and we were sitting around doing a new topic yesterday. And one of the questions, so this is given to us by the College of General Practitioners. One of the questions was, your patient comes in having read social media about this diagnosis. What do you want to tell her? And their immediate answer, if we were talking about from the exam point of view, would have been to tell the patient, don't trust social media, don't look at it. That's not where you should be getting your medical information. I said, yeah, but what do you do in practice? And they said, I actually tell them about some of the dietitians online that you can follow on social media because they give good information. I'm like,
Ah,
interesting. What else do you tell them? I tell them about a couple of physical therapists who show really good stretches or things for back pain. So I actually direct them to these people online. I'm like, interesting. I said, let's read what the answer is because it gave us the answer manual. And it said, social media is used by 99% of the population that have this disease. And so they're going to be seeing lots of different people about this condition on social media. And so, what your role is to help them understand what are the things they should be thinking about for this condition? What are the things we know in the evidence is good for this condition? And finding the social media outlets that help them get to the goals that they want. So actually help them find the right answers and follow along. So for instance, a mum with 3 kids who needs to eat an anti-inflammatory diet, it's hard to find those recipes. But if you've got someone online who's showing you really simple recipes that are anti-inflammatory, and it makes it easy to attain that, of course, they're the ones to follow, but don't follow things that aren't in line with these recommendations. So it was the how do we help people navigate this safely? And so that was they were really excited by that, that they didn't have to tell patients not to look at social media because that's not the lived experience of what they're doing inside their practices. And so
yes.
back to your question, when patients come in with I've read about this on the Googles and I think I have this. We've got physicians who are curious and physicians who are not. So physicians who are certain about how this should happen and are not flexible. And I think I see flexibility within curiosity when it comes to the clinical encounter. You'll have physicians who are not flexible in terms of how they're going to navigate this question. And they're going to get really frustrated that you wouldn't believe what they came in with the Googles and blah, 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 blah. Versus the interesting, tell me why you went look that up, or tell me what it was about that you saw in yourself, that curiosity piece. So when patients come in having read it, you're going to get whatever it is about the physician, that exactly what you were talking about before. Are they curious?
Yes.
Are
Yes.
they wondering why you went looking for answers? Or are they excited that you look to be interested in your health and have some ideas? So that motivational health interview where we say, instead of you've got diabetes, here's my lecture on it. Isn't it so much nicer when you have somebody say to you, okay, what about your diabetes are you working on right now? And how can I help that be
Mm,
enhanced?
yes.
And so
Yes.
if they say, I'm about to embark on this, I'm gonna run a marathon this year, you're like, you sound motivated. Tell me about your training protocol. Tell me about what you're going to be eating towards that. And we can just make little potential tweaks and suggestions to help them get their goals.
Yes. I love it. I love it. You're on the right path.
Yeah, so this is where I see some of what you were saying about that curiosity curve, that ability to be flexible. I see it like this as well. I've had physicians come to me and say they're knocking my appointments from 45 minutes down to 30 minutes. Now, that requires, in their brain, them doing everything they normally do, but talking faster. Or not getting any of the orders done. They'll have to do them later. That 15 minutes that they lost in real time will have to be put to the end of the day. I'm like, interesting that we had that concrete, literal, it's going from 45 to 30. I have to do it in the way I'd always do it. So now I've got to figure out where I'm going to do the rest of it. Rather than we have a conversation about, okay, what is it going to look like to do this in 30 minutes instead of 45? What bits stay? What bits go? What is the language we're using, the questions we're asking in order to have you looked after too? So you're not
Yes.
just having to put 15 minutes later or run 15 minutes behind. You can actually run within that 30 minutes if you're choosing to stay there, right? Because you have choice.
Yes. 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 I love that.
Yeah. Thank you for this conversation. This has been
My
really
pleasure.
interesting to have you come at a perspective from the C-suite. I know that the insurance part is so tricky for physicians to navigate in the US. The whole seeing if a patient's covered, working within the confines of what an insurance will provide. Is there anything you've learned about the insurance side of medicine in the US that is not the bad side,
Yeah,
good
I
about
mean,
it?
what's good about it is I think physicians, they get into the practice because they really want to help people. They have that heart of, I'm here to help. And insurers, or just even in our legislation, we make it hard for them. If it's not in the code, they have to work around stuff, and it's frustrating for them. And I don't know what the physician exit is, if there are more physicians leaving the practice than coming into it, but in the sense of we make it really hard for physicians to treat patients. And
Mm.
that's why there's the person I'm going to tomorrow, he doesn't take insurance. Everything I'm doing is out of pocket, but I'm doing it because I really believe in functional medicine. I really believe in longevity. I want to get ahead of that. And so I sacrifice and pay for it on my own. Now, most people can't do that, in the sense of my wish for the United States is that we would make it easier for physicians to treat the patients in the best way they know how, without having to figure out a code.
I guess you've got a lot of yeses out there about that.
Yes,
Yeah.
yes, and everyone has the right to healthcare. Everyone has the right to good healthcare, and I'm on a mission to make things different.
Yeah. And what's a message you might leave for our C-suite or leaders about their teams and the way they're functioning as a leader?
That leadership and culture are synonymous. So goes the top of the house, so goes the organization. So I encourage those in the C-suite to take a look at themselves and take a look at the executive team and say, how do we get better? How can we create a culture of curiosity?
I love that. Thank you so much for this conversation, Deborah.
My
And you guys
pleasure.
have a great rest of your week. Bye.
Bye now.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.